The People's National Party is extremely concerned about the state of Jamaica's health sector at this time. The Minister of Health and Wellness clearly cannot manage the portfolio, and the lives of ordinary Jamaicans are at risk on account of his ineptitude. This gross mismanagement of the health sector is not only confined to the hopelessly inadequate response to the dengue epidemic, but to other areas of the health sector at this time. Increasingly, we have had reports of longer waiting times at hospitals and health centers, longer time to see a doctor, and even when one is to be admitted, we have reports of shortages of bed to admit patients. In fact, some patients have to be accommodated in the emergency rooms, in chairs, and in some instances, on stretchers, awaiting bed availability on the wards. This, ladies and gentlemen, runs into 3 to 4 days at times. And examples of these were seen on a recent visit to Falmouth Hospital a few weeks ago. This problem has remained unresolved. Mandeville Regional Hospital, Spanish Town Hospital, and the Savlamar Hospital are reeling under this bed shortage problem, to name only a few. And we have had to be finding substitute accommodation for patients. There was also the situation at Victoria Jubilee Hospital reported in one of the daily newspaper some weeks ago, October 16, highlighting an even graver problem of an expectant mother awaiting delivery and sitting on a chair when in fact she needed a bed. That was 6 weeks ago, and conditions have not improved since then. We are not only unmindful that the dengue epidemic has contributed to the overcrowding in the hospitals, but the overcrowding existed prior to this and prior to the outbreak. It may only have worsened the situation as there were no attempts by the minister to prepare the facilities for the outbreak, for which we warned about nearly a year ago. We know too that the ministry has bought recliner chairs to alleviate some of the bed shortage. And while we welcome it as a means of alleviating the problem, we find the provision totally inadequate. We also have similar concerns of overcrowding at the health centers, the lack of sufficient health workers, and the long hours have frustrated to an already overburdened health sector. This has contributed to complaints of inappropriate and unprofessional behavior by health workers as they address patients, as well as the abuse of health workers by patients and relatives. Perhaps the most serious highlight today is that of the mismanagement of the dengue outbreak. My predecessor warned several times that dengue cases were rising, and there was a need for urgent management, including public education and vector control. We have seen where upwards of 63 patients, mostly children under the age of 10, reported dead since last year as a result of dengue. We, however, have some difficulty accepting those numbers, as there have been conflicting numbers coming from the Minister of Health and Wellness himself, as well as the many reports that we have had from all over the country of the number of patients, particularly children, who have died since January 2018. We have concerns over the numbers, as the minister reported on October 8, 2019, that, and I quote, for the period January 1, 2018 to September 30, 2019, there were 135 suspected and confirmed dengue-related deaths, 47 in 2018 and 88 in 2019. And he said then that 10 of these occurred in September. Yet in November, the said minister changed the numbers to reflect lower deaths. This is what he said on Tuesday, November 12, 2019, and I quote, as such, Mr. Speaker, as at November 7, 2019, there were 61 confirmed deaths, of which 17 were in 2018 and 44 in 2019. If, as the minister claimed, there was an error, it ought not to have taken 5 weeks to correct it. It is our opinion, however, that the minister is not being truthful, and the numbers being given are far greater than that provided by the ministry. He further said, as of August 28, 2019, there were 4,409 suspected, presumed, or confirmed dengue cases for 2019. And as at September 30th, 2019, the number of suspected, probable, and confirmed is 5,909, an increase of 1,500 for the month. Yet with the continuous spike in the numbers and the increased reporting by parish health authorities that they were seeing a rise, Manchester, for example, over 500, Hanover, over 400, Minister Tufton comes to the Parliament on November 12, 2019, and said there were 6,114 cases with onset in 2019, as at November 7, 2019, an increase of only 205 for the period September 30th to November 7th, 2019. This was even as his CMO was saying that for the preceding month in October, there were over 900 cases. The minister's numbers are suspect. What are we as a nation to believe? We need to have the full facts immediately. In this present situation, we cannot but feel the anguish of the many families, mothers, fathers, sisters, and brothers whose lives have been devastated and torn apart from the deaths of the young members. Had the minister heeded the call when it was first put to him in February, there would not have been an epidemic spiraling out of control. The minister denied in February that there was an epidemic, refuted in October that there was need to get more funds, as proposed by the opposition. As he said, there was enough funds coming from National Health Fund to do the necessary work up to December 2019 to contain the epidemic. Yet by November, with a rapid increase in the numbers being diagnosed and the rise in deaths, $1 billion is earmarked for mitigation programs. As we have pointed out in the many fora, the number of affected persons and the numbers of deaths could have been significantly reduced had the country embarked on a sustained vector control program earlier. Many of the children who lost their lives might have been alive today. The numbers have been so high that Jamaica has exceeded the PAHO projected dengue deaths as is reported, is among 11 in the region. The question I asked this morning, the question we asked, what measures we in Jamaica did not institute that the 20 other countries in the region which is being affected by dengue did? The ministry did not take PAHO's advice seriously, and we lost the battle and run the risk of losing the war. Of particular concern is the large number of children who are dying at the Bustamante Hospital for Children, the Specialist Children's Hospital, where 5 dengue deaths occurred in November. This, of course, is in addition to the many others that have occurred in other hospitals across the country. There's now a generalized fear because no one knows who will be next, whose child will be next. On this issue, the opposition cannot be criticized for not making suggestions or only criticizing the minister. Of note, the sequence of opposition suggestions are: 1, from February, we urge the minister to treat the outbreak as such. We called for more funding for vector control program later in the year. We suggested more temporary vector control workers to be employed. We recommended longer opening hours for health centers. We suggested that retired public health officials be brought back into the system to assist the overworked staff. We pointed to the need for community-based vector control workers aimed at gaining community trust and buy-in from the communities. We urged the use of test kits in the field, but the minister gave suggestions from his CMO that the kits were only 30% reliable. We refute that, as the current kits are upwards of 65 to 70% specific and sensitive. We urge retraining of medical health professionals and sensitizing them to better diagnosing dengue infections. But this approach to the dengue outbreak is symptomatic of the general situation in the health sector in the country. There are shortages of drugs in many of the local health centers and hospitals across the country. Simple medications, such as antibiotics, are unavailable at times. There are system breakdowns at the various hospitals. Princess Margaret Hospital has only been utilizing a half of its accident and emergency examination rooms, as mold due to defective air conditioning units have affected the facility. And even there, the X-ray unit has been out for weeks, forcing patients to use those private hospitals to pay to seek those investigations. The sewage problem prevails at Savlamar Hospital and needs an answer from the minister. Weeks ago, he announced an investigation. We need to know what is happening now. The situation at Cornwall needs an explanation to the country. Numerous deadlines have been missed in terms of pronouncement by the minister. We were told that it would have been fully renovated by April 2018. That deadline was shifted to February 2018, then it was shifted to April 2018, to September 2018, to November 2019. In August 2018, he appointed Dr. Archibald MacDonald, chairman of the Cornwall Regional Renovation Oversight Committee, to look at the project. And we were told that by December 2019, we would have a significant repair done and rehabilitation. We are now at December. The country needs an answer, and we need to know whether another deadline will be missed. It is time for the full restoration so that the surrounding health facilities in that region can resort to their usual functioning of coping with their smaller usual number of patients for which they were built to accommodate, taking pressure off Noel Homes, Falmouth Hospital and Savlamar hospitals, which are bursting at their seams. The minister also needs to explain his new public-private partnership for investigative services. We are advised that this $1 billion he announced, where patients will travel from their hospital to the private facilities nearby to get investigation, will be funded over a 2-year period with $1 billion. But we are also told by hospital administrators that they have to pay out of their budget for this payment. This is not new money. So we'd like to get a better explanation from the minister as to where this is going and coming from. If this was not all enough, ladies and gentlemen, we now had the unprecedented situation where Jamaica was without a medical council due to the minister's tardiness in appointing the Medical Council of Jamaica. The life of the board expired in August. And after 4 months, we were only told last night that a new council is now in place. The hiatus is regrettable. In the words of the minister himself, he said that fell through the crack, and he accepts full responsibility for that. But indeed, he has to accept full responsibility for all that has transpired in the ministry. The dengue crisis, the deaths of our many children due to dengue, the overcrowding of the facility, the long delays in getting hospital beds and after being admitted, the resorting to chairs for delivery at the maternity hospitals, the shortage of vital drugs at hospital, and many more. The performance of Minister Tufton clearly demonstrates that he's not up to the job. It's unfortunate that he's the Minister of Health and Wellness, and his continued occupancy of the ministry forebodes a worsening situation and for this country an increase in mortality. The Prime Minister should now act to remove him and give someone the opportunity to rescue Jamaica from this imminent disaster. Thank you.
Good morning, ladies and gentlemen. In addition to what Dr. Guy has stated, I think it's important that we put a human face on the issue. What's missing in our health sector now is dignity. When persons get sick, whether you're a policeman, a postal worker, a retired teacher, there's very little dignity in our health service for you. I think that the time has come where we stop patching the system. Public-private partnerships are good. However, I think we've outgrown that as a country. Now the time is right for us to make sure that each parish has many of these services so that persons don't have to cross many miles and the expenses to be able to get diagnostic tests, surgeries, etc., to cut down on waiting times. It's also time that we take the politics out of health. I've dedicated my entire professional life and adult career to caring for the sick, treating them, comforting them. I've had the unfortunate experiences of having to break the news that someone has died to a mother or a father, and it's heartbreaking. I know that the nurses, the pharmacists, the entire health team feels the strain, not just of the lack of resources where you just don't have enough to work with, but also the human cost. It's emotionally draining on the health team that we have to keep explaining to persons why they can't get surgery, why you can't get chemotherapy, radiation therapy on time, simply because of administrative issues and financing. When we look at the Prime Minister's dream for this country and roads and I understand about airports and expansions in tourism, all well and good, except our hospitals, our health centers have been suffering for years. The health sector has been falling apart, and we are now seeing the chickens come home to roost. I think that Dr. Guy has pointed out very effectively in the most recent situation with the dengue crisis, the strain on all the services. But further to that, when we look at the $1 billion that the Prime Minister is allocating for bush cleaning and pothole fixing, etc., couldn't that have been used to support the wages of the health sector, to increase some of the motivational factors to keep and retain our nurses, our pharmacists, our surgeons, all the members of the health team? The primary care system has been under strain. Persons are not willing to work in the most difficult areas, the furthest points of our country. And we've seen again where the government is willing to put money forward, but for temporary measures instead of dealing with the fundamentals, which include remuneration for all levels of the health sector. I worked in the health sector for most of my adult career in the public health sector, and I found that we're not after more money. What we want to see are improved conditions, improved appreciation for the health team so that they can deliver compassionate and timely care. If we keep abusing our health workers and our patients are unhappy and we have bad outcomes, what will we have as a country? Who will build our future? And that's why we're here today, to point out these issues so that we can start the conversation and action towards fixing the system once and for all. Once again, I think that the minister needs to address these issues frontally. We look forward to his responses so that we can have the debate on how we finance our sector, how we look forward to sustain development in the sector, and not simply use hospitals and health centers that were designed for a time when we had a smaller population and didn't have the rural-urban drift that we now see. Places like Portmore, places like St. Mary, Portland, the South Coast are all buckling under the strain. We can't keep going in this direction. The time has come for change. Thank you.
Crowding, bed shortage, those existed for a very long time. How would you respond to that?
We do agree that they exist for a very long time. But the minister has been a minister for 4 years. He has been given that responsibility by the people of Jamaica to be in charge of health and wellness, or health initially, then wellness subsequently. But you know, the definition of health has been, as has been defined by PAHO, it's a state of physical, emotional, a complete state of physical, emotional, and social well-being, and not merely the absence of disease or infirmity. The fact is that he has been given that responsibility, right? It's not that he had it yesterday. He has had it for 4 years now. And the government is operating in a climate where they have access to more spending. So the minister ought to have been able to foresee that this was what was happening.
Vashan, if I can also just chime in on that. You know, we see healthcare as a cost instead of an investment. Two wrongs don't make a right. If something was wrong before, no problem. You can call us out on that issue. We're happy to address it. But right now, there are people in waiting rooms. There are parents who don't have answers about their children. And so something has to be done. Kicking the can down the road, you know, in the way it has been done. As you know, I've been in this for many years now, advocating for what I just said. And what we really need is a genuine conversation so that the country, the average man, can understand why there must be dignity in illness. Just because you're poor is not a disease. Whether you're diabetic or you have cancer, there are issues that we would all face, rich and poor, whether you run a bank or a farm. And what we want to see is a more equitable distribution of the resources so that rural Jamaica and urban Jamaica can benefit. And so we set a platform where we can respond to these kinds of epidemics, because as an essential service, as an emergency service, we can't simply wait until we realize enough people are sick to go and buy a van or a truck to do, you know, fogging, or buy an ambulance or expand a particular service in the hospital. We have to be proactive. We have to be in a position where we can forecast not just the investment in health year on year. So in other words, we should know now and over the next 5 years what the budget will be for the healthcare system, so that administrators at the regional level or hospital level can forecast expenditure and investment, so we know how to grow. As well as at the same time, the human resource element, Rashan, is very important. A lot of the issues we face are to do with the fact that we have not addressed the human factor. We speak a lot about patients, as we of course should. They are the central component of the whole service. But the persons that administer that care are also suffering. And I think it's a holistic approach. And one of the things that I find regrettable is that our information is that the minister has not brought everyone to the table in a consistent manner. And we have to share the information, not just with the Medical Association or the Pharmaceutical Society of Jamaica, but the nurses, the physiotherapists, the nutritionists, to get consensus on the way forward. Because what seems to be absent is a published plan. I know there is a plan, a roadmap for 10 years, but none of us have actually seen it to be able to say to the ministry, look, these points are good, but how can we address these more effectively over the short and medium term? But I think, yes, you're right, it's existed for many years. But I think that if we take that phrase out and start to say, as of today, what are we prepared to do as a country? The only person that can answer that is Dr. Tufton.
I do have a follow-up on dengue. You spoke about vector control workers earlier on, yet at the same time we see a number of attacks involving them. How do you get around that?
Well, as I indicated earlier, and let us understand that it might not only be happening in Jamaica. PAHO recommended, and I mean good reason and good sense should indicate, that they recommended that part of the intervention in vector control is that you get community involved in it, people from the community. If you listen to where these attacks are coming from, you'll recognize that they are in mainly volatile areas. People are afraid of strangers coming to their community. So one of the ways of getting around that is to have people who are from the community to work alongside with those who are the specialists in the areas. You know each other in the community. There's less likelihood that you'll attack them.
Any other questions?
Shaban Campbell, Nationwide News. This is to Dr. Alexis. PNP President Dr. Peter Phillips has called for a GCT tax cut. Mr. Jackson, the National Security spokesperson, has called for a Christmas bonus for security forces of about $1.2 billion. You're calling for increased remuneration to health workers. Are all these requests in keeping with fiscal prudence that Jamaica is currently on, or are these requests just being made on the basis that no administration would take them seriously anyway?
Just as Dr. Alexis comes in to respond to that, just want to point out that today's press conference is specific to the health sector.
I understand.
And
But
perhaps
these are all connected.
perhaps
and I would like a question answered. Thank you.
It will be. And perhaps a rejoiner to your own question is, what's the price you pay on the loss of a child's life? Continue, Dr. Alexis.
Right, so I think I welcome the question. The truth is that, you know, when we speak about healthcare, we try to speak about it in a silo, and I think it's wrong. So you're absolutely right. The cost of violence, Dr. Elizabeth Ward did extensive work. Over $1 billion is spent by us just to patch up persons from motor vehicle accidents, injuries from stabbings, traumatic injuries. And so when we look at the cost of healthcare, we have to look at what's happening in the society. Overall, I've always advocated that the remuneration has been inadequate. But it's also true that there have been several groups, including a paper I published in 2010, that pointed out that in the top 3 issues that public healthcare workers have, it has to do with conditions of service, security of tenure, issues with pensions, contracts, etc. So it's about appreciating our staff. At the end of the day, we also know that when you work 70, 80 hours a week, right, there is a cost to that, and we have to address some of the economic factors, because when people from the United States, the UK, Canada come to recruit, they are dangling dollars in front of our healthcare professionals. And the fact is, we're sitting down like impotent men, watching someone take our loved one out. We have to do something more. And so I agree with the calls made to try and reprioritize, especially in security, health, and education. And at this point, I think there are reasonable suggestions. We welcome if there are any counters to that, so that we can debate where the money can come from. But I certainly think that the $2 billion that was announced between the Prime Minister and the Minister of Health would be a good start in investing in the actual human resources in our health sector.
Prince Moore, RJR, what suggestions do you have, Dr. Guy, to address some of the ills in the short to medium term that you identify in the public health system?
First of all, I think the minister and his team need to recognize what exists, first of all. You need to have an appreciation of what is there before you can deal with the ills that occur. So, for example, I mentioned about the malfunction equipment in hospitals. There needs to be a greater attention paid to it, instead of awaiting until you see the media reports it that this is what is happening. You, as Dr. Alexis said earlier on, you need to be more proactive in what is done. It is not sometimes that there's a shortage of health, of say, for example, medication, although there are real shortages, but sometimes it's how you allocate it to the respective areas. And I mean, I'll give you a practical example. A patient came to me because he could not get amoxicillin, which is a simple antibiotic, at the Portmore Hospital, but it was available at the clinic in Highgate. Now, things like these, bus fare has to be invoked. You know, the patient has to spend time to get it there, or they go to the private hospitals. Most private facilities to buy it. Most times they resort to doing that. So you cannot say that you have a health sector that is catering to the needs of the people when you have simple shortages. What you need to do is a total reallocation of what is there, because sometimes it is not, as I said, it's not there totally, but it's where you have it. That's just one. The other matter is the maintenance of these facilities in the hospitals and health centers. They are bought, they are put down, and there's no maintenance. I had the fortune of assisting some time ago at a back-to-school health fair for children. And I went to a health facility, a health center. The region was gracious enough to allow us to use it on a Saturday and a Sunday. And there was a very expensive blood pressure machine, a sphygmomanometer, which was digital. It was thrown in the corner, dust gathering, right? But it was still being able to use. And I used it for the entire 2 days I was there, but it's not being used, right? So it's a function of what is there, how you maintain it, so that you keep it going on forever, or as long as the life is.
Hi, Dr. Wickham, who has also joined us, would like to add a couple of points on the last question.
First of all, I'm sort of just a pinch hitter, just adding something to what was said earlier. Based on Dr. Guy, the opposition spokesperson, we have all been in touch with our health authorities. And I think it's important because the question was asked, how could it be done differently? I think with regard to dengue in specific, what our concern has to do, it's with the timeliness and the effectiveness of the response to this dengue crisis. The fact of the matter is it started somewhere late last year, around November, October sometime, came up in January, came to public. We have been talking about it since then and what the response should be. To date, when I speak to my persons in Westmoreland, there's a real problem. At this point in time, we had one motor vehicle in the Department of Health for the entire parish of Westmoreland. One motor vehicle. And it went down last week. So now the only thing that they have is a rented vehicle. Now it can't be that you are in a crisis for the entire year and the health department has no vehicle to respond to this crisis. And understand there are two sides to it. One, you have to have the prevention, so they have to go out and actually educate, which means transporting the persons. And what they've been doing is renting a vehicle, and they have to do it on alternate days. And the other is the fogging. And the fogging is important because although we speak to the fact about fogging and the extent to which we fog and its preventiveness, where you have an outbreak and you actually have mosquitoes with the infection, there's a real problem because if you don't fog it, they're going to infect other people, infect other mosquitoes, it's going to continue. So you have to treat the adults as well. And in Westmoreland, we have not had that. We don't have the extent that we wanted. Back in the Chick-V outbreak, we were up to 5 vehicles. Now, vehicles have been ordered, but to date, they have not arrived. So when we are here complaining, it's really because we don't see the sort of timeliness. You hear about this, let's do this as a short term, that as a short term, but the basic things like empowering your health authorities, your health, the regional health managers, we don't see it in the way that it has happened in the past. And I went into a community, Egypt, 2 weeks ago. I was at a bar talking to some people, and there was a girl there, Teresa. Teresa had just come out of hospital, and her 2 children were still in hospital with dengue. Both of them, their platelets had fallen, and they were both admitted. When I talked to the people in the community, there were about 6 to 8 active cases at that point in time. Now we went in, we bushed it out, took some people, education. I had to hire a car, a truck, a van to fog. But the fact of the matter is that this is way down in the crisis. And I think that what the spokespersons are asking for is a more effective and timely response to this outbreak.
A question was asked earlier on in terms of collaboration. I want to make it known that the minister has invited myself and my team to meet with him from last Tuesday to discuss this, but we have not been able to find a mutually convenient time for meeting because his times don't coincide with ours, but we're still planning to have that. But you know, I just want to say something and to put back the human face as Dr. Alexis mentioned earlier. Out of nowhere yesterday, my phone rang. This lady came on, who I know, never had her number, but she's a senior technocrat in one of the ministries. And she said to me, I'm glad that you're speaking about what is happening with dengue because my child died at Bustamante Hospital in February. And she said that he died because there was no urgent attention to his case. He died within 24 hours after being taken to the facility. 4 years old. And she said yesterday was 9 months to the day when he died, that she was just getting the death certificate for the child. Things like these happen. Things like these happen that we don't know of, but it was brought to our attention yesterday. And every day I get on my phone or WhatsApp, one more child from my community has been infected with dengue, or one child has died, one more has died. This is untenable. We cannot as a country continue like this, because we are putting and exposing the future of our country in peril.